When you think about big, complex places like hospitals, you assume safety is paramount, right? And often you see things like ISO certifications. We kind of instinctively think, okay, that means top quality, super safe. But does it really? Does getting that ISO stamp automatically make a hospital safer for patients and, for the staff working there day in, day out? Today, we're doing a deep dive into that very question. We're looking at how ISO certification actually impacts something called patient safety culture in public hospitals. Our guide here is a really interesting 2025 study by Kyriakeli and colleagues. They look at a large Greek teaching hospital, a tertiary public hospital, so our mission. To unpack what this study tells us about how these big international standards, how they really work on the ground.
Yeah, and before we jump into the study itself, it's probably helpful to clarify what we mean by patient safety culture, or PSC. It's basically the shared mindset, the values, the beliefs about safety within the hospital. Think of it like the organization's personality when it comes to safety. It guides how staff see safety issues, if they feel safe reporting errors, that kind of thing. It's fundamental for cutting down medical mistakes. And ISO certification, like ISO 9001, or the one specifically for healthcare, ISO EN 15224, that's a big, globally recognized system for managing quality. It aims to standardize things, improve processes, and hopefully boost safety.
Okay, got it. So PSC is the culture. ISO is a system meant to improve things. How did the researchers, Kyriakeli and her team, actually go about studying this connection?
Right, so they had a pretty smart setup. It was a two-phase study. They looked at departments before any ISO certification happened, comparing those that would get certified later with those that wouldn't. Then, they waited 18 months after some departments got certified and measured again. They used a standard tool, the Hospital Survey on Patient Safety Culture. It's a well-respected survey that asks healthcare staff to...
Okay, so enough time for changes to potentially embed. What did they find? Was it a thumbs up for ISO?
Well, that's where it gets interesting. The study actually showed a mixed impact, is how I'd put it. There were definitely some positives, statistically significant ones. For example, they saw real improvement in supervisors' or managers' expectations and actions promoting safety. So managers seemed to be clearer and more active about safety rules after certification.
Okay, so leadership stepping up more visibly.
Exactly. And another big win was in handoffs and transitions. Communication between shifts or departments got better, and that's huge, preventing information from getting lost when a patient moves around.
Right, dropped information during handoffs is a classic danger zone. So improvements there, that's definitely good news. But you said mixed impact. So what were the downsides or the areas where it didn't help?
Yeah, this is where it gets really nuanced. They found no significant change in the overall perception of safety. So despite the certification, the general feeling of safety among staff didn't really budge.
So the paperwork improved, maybe the processes, but not the gut feeling about safety overall.
Seems like it. And maybe even more telling, there is no change in non-punitive response to error. This is critical. It means staff likely still felt worried about being blamed if they reported a mistake.
Oh, that's a big one. If people are afraid to speak up, you can't learn from errors. That culture of fear didn't change.
Precisely. Also, staffing perceptions, how adequate staff felt their numbers were, that didn't improve either. So certification didn't solve underlying workload or staffing pressures.
Which are often huge factors in safety incidents.
Absolutely. And one more complex finding, teamwork within units. The ISO-certified departments kind of stayed the same, but the non-certified ones actually saw a slight decline in teamwork over that period.
Interesting. So maybe ISO helped between departments, like with handoffs, but not necessarily inside the teams themselves.
That seems to be the implication. So pulling it all together, ISO looks good for structure, for management oversight, for those interdepartmental processes. That's valuable, no doubt. But it doesn't seem to automatically boost that frontline feeling of safety or create a blame-free reporting culture or fix staffing issues. The study even hints it might make staff judge safety more harshly or maybe just add more paperwork.
So wrapping this up, the big takeaway seems to be ISO certification provides a useful structure, a kind of scaffolding for quality. But it's definitely not a magic wand, not a silver bullet for changing the deep-seated culture of patient safety.
Exactly. You can certify a process, but certifying a culture, that's a whole different ballgame. It leads you to think, doesn't it? While having a standard like ISO is a starting point, this study really suggests hospitals need more. They need things like, really strong, visible leadership commitment, specific training for staff, and focused efforts to build that trust, that non-punitive environment where people feel safe speaking up.
So a final thought for you listening. If formal certification isn't the complete answer, what other elements do you believe are truly essential for building a patient safety culture that's not just robust on paper, but genuinely humane and effective for both patients and the staff caring for them? Something to mull over.